I'm Aaron Duggan and I'll be taking the Health and Social Care course based in Banbridge here, and then obviously working across Newry and Lurgan sites as well. I originally started through school, went to Newbridge Integrated College here in Loughbrickland and studied then Health and Social Care as one of my A-levels. Always wanted to do nursing, so then was lucky enough to get into Queen's and studied my adult nursing there, general nursing through Queen's, and then was able to go out into the Southern Trust then, so was lucky enough to get a job in the Southern Trust and go out and work there. So in the backgrounds of surgical, so it was theatres and endoscopy units then as well, alongside some of the surgical wards. And then just decided that I would like to make that transition into teaching then. Always loved the lectures and always loved the learning aspect of it as well. And decided just to make that transition then into teaching. Actual course is broken down very well. It looks at the various different aspects of working within a health and social care setting, so I believe students obviously get to that full range and that wide variety of knowledge and then experience as they're going into those placements and workplace settings. And then learning as well down to the basics of your anatomy and physiology and looking at your body systems and how to treat people with those core values of care, compassion and respect. Absolutely fantastic, really good. This would be my first initial time into the new campus, and I have to say when I first came in I thought it was fantastic, and the rooms and the facilities here that the students have, like the library and things, it's very good, top notch. Yeah, so obviously one of the main ones, nursing is a key one. Students can progress on and do jobs in the social work side of things, looking at that. Anything really that they feel that is within that scope of that health and social care setting. Even if students wish to work as nursing auxiliaries, sort of helping out in those clinical settings, there's a wide variety of jobs, and the beauty about health and social care is there's a role for everybody. So it's very inclusive in that sense, and students will then feel that when they're out on those placements, and they will feel that togetherness of there is a place for everybody. Well, obviously going into do your A-levels, it's a completely different style of teaching, so it's more sort of theoretically based with your A-levels, and there unfortunately isn't a lot of placement areas that you can go and do throughout those 2 years. However, coming here and studying the course here, it allows students to get that, as I mentioned before, that wide variety and that very wide base of being able to put their theory into practice then, and being able to complete that through their placement hours, which I find essentially brings the learner, it's a full cycle. It brings it together, it brings the learner together, and they're able to see what it's really like working in those situations. And then this also, I feel, prepares students better for if they want to take that jump and go to university. This is also a very good base for students to be able to do that. So.